This segment of DelmarvaLife is sponsored by TidalHealth.
Even though March shines a spotlight on kidney health, it's something that deserves our attention every single day, and for good reason.
Our kidneys do a lot behind the scenes, and when something goes wrong, it's not always easy to spot. Today we're joined by Dr. Kazi Khan, a nephrologist with TidalHealth. He's here to talk about kidney disease and why it's often called a silent condition. So welcome.
Thank you.
Thanks for joining
Glad
us.
to be here.
Mm-hmm.
So we're talking kidneys, and what are some of the things you'd like people to know about kidney health?
So kidney disease is very rampant and common on the Delmarva Peninsula, and we are out educating our patients to be careful if they have any kidney disease conditions and being followed closely by a kidney specialist, because the unfortunate part is in the beginning when this starts, nobody notice any symptoms, okay? And when the symptoms starts, which are swelling in the legs, shortness of breath, feeling tired, no energy, the kidney disease has progressed too far. And it's difficult, impossible to turn them around.
Is that why they call it a silent condition?
Exactly, exactly. So initial stages are that you don't even feel anything. But it's a simple urine and blood test you can do, okay, and figure it out that there's an issue and it can be addressed. All we can do is slow it down, okay, and not let it progress, but only if we know or only if we see the patient. So, yep, that's important.
So there really are no symptoms until it's too late?
Yes, unfortunately.
Wow. Okay.
So in the beginning, you don't feel anything, okay, and it's just the labs, the blood tests are abnormal. That's why it's important when you go and see your primary care that you check with them and see what the kidney functions are.
And we want to talk a little bit about TidalHealth's Nephrology Fellowship. How is it help to strengthen kidney care right here on Delmarva?
So what we are doing is training the future kidney specialists right here on Delmarva Peninsula, where we educating them, training them, okay, with latest advances in kidney disease. And we are hoping that, you know, they will stay with us and provide the access which we need. We are hoping that there will be less short time seeing these patients, managing them rightfully, and will continue the care that the patient needs here.
So that's important that that's kind of staying here and kind of growing here as well for your patients or future patients.
Exactly. So there'll be the shortened time of seeing the nephrologist and getting the care on time, which is very critical for these patients.
Back to early detection, if you were going to your doctor, you know, for your well check once a year or so, your blood tests do show kidney levels, and
yes,
you can tell that way? Now
it's standard part of the blood test. Every time they do a blood test, they can look at the kidney functions. And that's where I'm saying if you're a patient, you do inquire about what the kidney functions are and then address them with your primary care. That's the first set. And then at that point, if the primary care feels like they need the help of a kidney specialist, then we are available to help them.
Right.
So what's one thing that you could suggest for viewers just to maintain good kidney health going forward?
So first thing is first, you know your numbers. That's very critical. If you're diabetic, you need to know what your A1C is, keep it below 7. If you have a history of hypertension, which is the most common cause along with diabetes of the chronic kidney disease, make sure you don't know the numbers and keep them below 130 over 70. And also ask your primary care about your kidney functions.
Ask questions.
Yeah, ask the questions. Dr. Kazi Khan with TidalHealth, thank you so much
My pleasure
for
being
joining
here.
us this
Thank
afternoon.
you so much.